to Z of the human body.
My toe bone's connected to my foot bone. My foot bone's connected to my heel bone.
This segment may contain... Oh, too late. The A to Z of the human body on weekends.
Imagine holding on to a lifeline, a telephone when you're feeling low, a flotation device if you fell off a boat, a rope that someone throws out to you if you're in danger, something that gives you life, saves your life. Guess which body part I'm talking about today? Look, you don't have to think too hard. You can just look down at your belly button, that special place that was once connected to your, connecting you to your mum, your literal lifeline. Yep, U is for umbilical cord, the one that you used to have. Dr. William Tarnow Mordy is involved in some pretty important research when it comes to umbilical cords. But before we get to that, William, when does our umbilical cord start to form?
About 5 weeks, Andrea.
So that's pretty early on. What is in the cord and why is it so important?
Well, the umbilical cord has got an umbilical vein and 2 umbilical arteries. And they're very important because the umbilical vein takes oxygen and nutrients from the mother via the placenta to the baby, and the 2 umbilical arteries return this blood after it's nourished the baby back to the placenta and to the mother.
So it's not a one-way street. Things are travelling in both directions then?
It's very much a two-way street.
Yeah. How long do they get? Do they get pretty long?
They can do. They're usually about 50 to 60 centimeters long, but they can be up to 300 centimeters, and they can be as short as less than a centimeter as well. So It's a big variation, but about 55 centimeters.
300 centimetres, they can get up to that size. I mean, that would mean that the cord would get quite knotted in some cases.
It certainly can. And in general, in about 1 or 2% of pregnancies, the cord does undergo a true knot. But in the vast majority of cases, those babies come to no harm at all. However, if the cord does get tight and if the knot gets tightened, it can be life-threatening. And this is a very important point because if any mother is concerned that she's experienced a changing pattern in the kicks that she's feeling, if there are fewer kicks than she's normally used to, or the patterns change, or the kicks are weaker, then she should get in touch with her midwife or obstetrician by phone as soon as possible. And if that's not possible, then the mother should go to the maternity hospital as soon as possible, day or night, for where they can do an ultrasound. And more about this advice is available if you type Safer Baby Bundle, Safer Baby Bundle, into your web browser, and you can then jump onto the website for the national campaign on reducing stillbirth, which has been launched by the New South Wales Clinical Excellence Commission.
How common is it for a baby to be born with the umbilical cord tangled around their neck? You hear of it, don't you?
That's very common, about 20 to 30% of cases, but the vast majority of those babies are absolutely fine.
Yeah, and is it usually in that kind of when a mother is about to deliver their baby where those complications and kind of knotting or entanglements usually occur?
Well, it can occur at any time, but it gets exacerbated when you have the onset of labour, which tightens everything up.
Mm-hmm. If you have twins, does that mean 2 umbilical cords?
Yes, it does. And if you have triplets, 3 umbilical cords, and so on.
Once the baby or babies are delivered, the cord is cut. Does that hurt the baby? Does it have nerves?
No, not at all. There are no nerves at all in the umbilicus, so it doesn't hurt the baby at all.
Cutting the cord can be seen as a bit of a rite of passage for the non-birthing parent. Do we know where that idea came from, that they get, to cut the cord?
To be honest, I have no idea where that came from. It is an increasing phenomenon, but and I think it's a good thing to involve the parents, but I don't know where it came from.
Mm-hmm. And is it true that some parents never clamp the cord? They never cut it. Instead, they kind of carry the placenta around with the baby until it naturally detaches?
Yes, that does occur. It's not very common. It usually would take about 1 to 2 weeks for the cord to dry up and fall off, and in some cases up to 21 days, 3 weeks.
Mm-hmm. I suppose most mums would find that a hassle to be carrying around the placenta as well as the baby.
I think so. That's probably why it doesn't happen very often.
Yeah. Umbilical cord stem cells are used for research to treat a number of life-threatening illnesses. What potential does it have, these stem cells?
This is absolutely true. They're indicated for use in a lot of congenital conditions like Fanconi's anemia, I think was the first example of an adult disease that was treated with umbilical stem cells. And there are at least 80 other clinical conditions, including some cancers. So there are substantial potential benefits. And by the way, it's important to point out that delaying clamping for a minute or more, which is in the baby's interest in the vast majority of cases, does not preclude, it doesn't prevent harvesting stem cells from that umbilical cord. And so you can do both. And in this regard, I'd like to point out the work of my colleague Atul Malhotra. Dr. Atul Malhotra and his colleagues at Monash University have been doing some pioneering trials looking at using the baby's own stem cells to improve tissue repair and reduce lung and brain injury in severely affected, severely ill babies. So that's very exciting.
Other exciting research is around the delaying of the cord cutting. Why would that be important?
Well, we think until recently we hadn't really fully appreciated that preterm babies will start to breathe if you give them enough time. We know that term babies will breathe within about 10 or 15 seconds as soon as they come out of the womb. But the same is true if you give them enough, up to 60 seconds. More than about 90% of preterm babies will also start breathing. And until recently, and certainly the first 10 years of this decade, it used to be routine that for a very preterm baby, you wouldn't wait that long. You'd clamp the cord immediately and then give the baby to the neonatologist. And we now think that by doing that, you've denying the baby the chance to naturally transition to improve pulmonary blood flow, improve the lung flow, blood flow to the lungs, and have a natural transition. And by doing it too early, what can tend to happen is the baby gets unnecessary resuscitation. Yeah. And so that's probably the reason why there's been a big change in an improvement in the outcome for babies simply by waiting and giving them enough time to naturally transition to air breathing.
Should parents ask to delay the cord cutting then?
I think so. And the World Health Organization for several years now has been recommending that in babies who are both term and preterm, that you should aim to wait for between 1 and 3 minutes before clamping the cord, unless the baby needs urgent resuscitation with positive pressure ventilation. And we think that about 15% of babies who are very preterm may need that, and only about 5% of babies who are term may need that emergency resuscitation. So that routine cord clamping should, we think, be normal, because that will improve anemia, improve infant iron stores, and therefore reduce the risk of delayed development, delayed intelligence, cognitive and learning development associated with anemia.
How remarkable is the umbilical cord? When you look down at your belly button, Professor William Tarnow Morty, do you reflect on how incredible it is?
Well, I must say, until this program, I've kind of taken it for granted.
Yeah.
One of the other things I wanted to just bring into the picture was that our group has been associated with a really world-first pioneering trial called the Australian Placental Transfusion Study, which was concentrating on babies born more than 10 weeks early. And we recruited about 1,533 babies into this trial. It took about 12 years to do it. But we showed that by aiming to wait for a minute or more before clamping the cord in these very preterm babies, that was led to a reduction in death or disability, defined as cerebral palsy, severe hearing or visual loss, or learning or language delay. So that's a major advance, and it should be informing policy and practice worldwide, we think. And that was also with a 30% reduction in mortality amongst those 2-year-olds. So that's a really big finding, which we think needs to be widely put into practice.
If people wanted to find out more about that research, where can they head?
Well, one of the best ways to go is to go on the Alpha Collaboration website. The Alpha Collaboration stands for Advancing Large, Collectively Prioritized Perinatal Trials of Health Outcomes Assessment. It's a bit of a mouthful. You type in alphacollaboration.com into your web browser, it'll take you straight to that website. And one of the papers that you can download for free is the Australian Placental Transfusion 2-year follow-up study. And one of the points that we make on that website is that, look, this is great news. It's fabulous news to find something simple as this that only requires a clock that can save lives and prevent disability. But it did take us 12 years in 25 hospitals in 7 countries, including Pakistan. And if we can move forward to recruiting from babies from, say, 250 hospitals worldwide, then we might be able to get answers to questions like this in 1 or 2 years instead of 12. And in the 10 years difference that was accounted for by that delay, there could have been 50,000 babies worldwide who could have benefited from delayed cord clamping. So we want to move towards a kind of trial that, a little bit inspired by the COVID trials in the UK, the recovery trial. It was about 11,000 COVID patients in less than 3 months, and it answered some very important questions very quickly. And we need to take a leaf out of that book and start to do the same in perinatal trials. Yeah,
we can actually get things done a lot better, so people can, I guess, a lot of babies can be saved and a lot of lives can be saved. Professor William Tarnow Morty is a professor of neonatal medicine at the University of Sydney Westmead Hospital. Thank you so much for your time today.
Thanks for having me.
Weekends with Andrea Gibbs
on ABC Radio.
I want you to stay with me. I want you to grab your pen and a piece of paper. In a moment, I am going to play you a mix of 20 TV theme songs. You're going to try to guess the lot of them. If you can get 20 out of 20, you better let me know. But get your pen and a piece of paper ready. In 30 seconds' time, you're going to get the quiz.
Nominations for your Australian of the Year
are now open.
It's time to reflect on your community
and who you admire.
It's time to show your respect
by nominating
and acknowledging them.
And it's time to celebrate
their story,
their contribution,
and their generosity.
I'm Hamish McDonald, and I'd love you to nominate an inspirational Australian who you think is worthy at australianoftheyear.org.au.